Hi, this is Gary Collins of the Primal Power Method and Heath Squier, CEO of Julian Bakery. We're here with Holistic Dentist Stacy Godes. I love that last name. That works perfect.
Yeah.
And we're here to talk about holistic dentistry today. I'll give a little disclaimer. Where Stacy works is where my dentist works, and that's how we met each other. And I've recently got all of my amalgam fillings removed. And it was kind of understanding the process, but we'd like you just kind of to explain basically what is the difference between the dentistry that everyone is used to, standard dentistry, and holistic dentistry. What does it mean and how is it different?
Question, because I get that all the time. People always ask, what is holistic dentistry? Like, what the heck does that mean? And basically, the difference between holistic and traditional dentistry is that we look at the body from a holistic point of view. And so, when you look at the word holistic, it comes from the term whole body. So we don't go and we want to find out the problems, the source of problems, the source of infections, how mercury can affect you systemically, how biofilms and periodontal disease affect you, heart attacks, how they're interrelated. We don't just look at a tooth and say, let me take that filling out and you're all done. I do personally a lot of muscle testing, so there's a lot of difference between, looking for biocompatible materials, how root canals affect your system. It's all interrelated, and I do a lot of nutritional counseling for my patients because that's on a different subject. It's amazing nutritionally what you can do and not take care of your mouth. And so it's just interesting. Our new patient exams are pretty extensive, and we really dive into a lot of these things. So it just comes from more of a not symptom based. It's just more treatment of the whole body, and this is kind of one aspect to it, your mouth, and it's really the gateway to your health. So
yeah, I bet you probably deal with a lot of people that have no idea they have infection, and then probably it's creating all these other health problems. I think so many people probably struggle with infection. And have you noticed, like, a lot of people, maybe since you do consulting on the side, is people struggling with weight loss and that kind of tying into the health of their mouth, that they're not able to lose the weight because they're dealing with a lot of infection and so forth in their mouth. Is there any sort of tie that you see there?
I do quite a bit. I mean, with patients, unless they bring up that subject, it's, kind of a sticky subject sometimes. But I have a lot of friends and patients that want to talk about that, and they're totally interrelated. I have a lot of patients coming in that say, I'm grain-free or I'm gluten-free, and gluten-free, that's fine, but that doesn't have. There's a lot of inflammatory foods, as you know, that you can eat that are gluten-free. So creating inflammation in your body obviously creates inflammation in your mouth. It affects periodontal disease. So it's 100% related. And you can't distract from the fact that weight loss isn't related to how your mouth is. A lot of times these patients will open their mouths and they're filled with mercury, or they have periodontal disease. They haven't been to the dentist in 5 years. So you can't disregard that as a dentist. I think that's just really a shame that most dentists don't look at it as, kind of a biologic kind of point of view. So,
can you explain a little bit about how infection would affect the body in terms of maybe it's struggling to constantly fight the infection, or creating, I don't know what the tie-in would be between the two, like a little bit more specific.
Sure. Obviously there's a lot of kind of tests that we can do. We don't do all of them, but there's a lot of differences with, like, pH and alkalinity and the biofilms in your mouth. Dr. Vane and I just got back from an advanced ozone seminar this past weekend, and there's a lot of tie into that with how you clean out the gingival tissues and the bacteria and inflammatory process. And having it's not uncommon for people to have, let's say, heart attacks or autoimmune issues or certain which are on the rise, and they open their mouth and it's filled with inflammatory issues, either abscesses or, mercury is a big one too, because it creates an inflammatory process. It affects a lot of plaque and things in your mouth. And so you get gingival irritation or inflammatory issues and breath problems. Their trace minerals aren't there. So you have to look at it from a nutritional standpoint too, if they are on the path of trying to get their overall health in tune, and you can't disregard that. So we work on a lot of issues with our patients too, and we educate them quite a bit to realize the connection between the two.
Oh, that's great. Yeah, I'm actually probably going to have to come see you.
Absolutely.
Right now I have I need a post put in, I think, and I've been going back and forth with the dentist, and I've gone to 2 different dentists, and one saying, well, we could just pull the tooth and do a bridge versus a post, and I'm going through all this battle, and it's really expensive, and you want to make the right decision, long term, but at the same time, you just got to do it. And I think a lot of people are just lazy when it comes to their mouth and paying attention to it. And it's so sad because, it's like they're doing all this other stuff, like you mentioned, to take care of their body, and their mouth comes last.
Absolutely. It's a shame, but that's the honest truth about it too. You have to look at yourself and what the best kind of treatment is for you, but you have to realize that all teeth are on certain meridians of your body. They do affect your energy level at different systems. It doesn't mean that every one of them is going to be affected, but on a side note, when I met my husband, he had a lot of inflammatory prostate issues. And I met him and I said, do you have a root canal on, this upper tooth? And he goes, what are you talking about? And he did for 20 plus years. We finally, after 4 or 5 years, got him to take the tooth out and just dug out the bone around it, so infected. And he had immediate results the next morning. And it's just amazing when you see that, on a daily basis with patients, how they're just floored by the fact of what you can do in their mouth will heal the rest of their body. It's just unbelievable.
That's actually what I had. It's specifically on this upper side here. I had a root canal that was done really well. It was done, like it was supposed to be the best kind of root canal, but it ended up going bad. And now there's infection up there. And now I got to get the whole thing pulled out and a post put in. Is there any sort of natural alternative to getting a post put in?
Well, a post means that you probably have had a root canal, correct? Or are you talking about?
Yeah, that's what I'm saying. I had a root canal that actually ended up going bad, even though it was top of the line root canal. It was done like in the healthiest fashion, using all the healthy things you can put in there, but it went bad. And now it's infected. I'm just wondering, for people out there, are there other alternatives, or is it really just a bridge and a post when you have a root canal go bad?
Well, that could be another hour-long talk because
yeah, let's save root canals for a whole nother episode.
Yes. On the short term, they, in my opinion, are dead tissue in your body, and any kind of dead tissue gives off bacterial toxins. And you wouldn't keep dead tissue in some other part of your body. The mouth is the only place that we consider keeping dead tissue. So are there healthy ways to clean it out? I do believe so. With the advent of ozone, and it's amazing the difference if you use ozone, because it can penetrate all those millions of accessory canals. So if you have 10 root canals and you don't want to lose all your teeth, you may opt as an option. If you've already had root canals done the unhealthy way, that you may not want to consider, removing some of those, because the source of the problem is not the bone. The source of the problem is your tooth. So
if you do that, so if you have a bad root canal like that, is there times when you'll say, well, we're not going to remove it because it will release all those toxins right into the bloodstream? Is that
No, because if you have an infection like that, a systemic infection, you want to get the source, which is the tooth, out.
Out. Okay.
Out. So you actually, we do different things at our office using ozone and different homeopathics to clean out the area and make sure the bone is clean, so the bone will form back in.
Can you explain the ozone a little bit more? Ozone's I used to actually deal with this at the FDA. I used to have to investigate a lot of holistic practitioners that used ozone.
Yes.
Don't ask me why. I didn't get it, but because it kind of has kind of the quack medicine attachment to it. And explain why ozone is so superior in the treatment of infection, because ozone's O3, right?
It's O3. Yeah, and people need to realize too, it's not FDA approved. Most of the things we do aren't FDA approved. It'll never be FDA approved. Ozone is a form of oxygen. You can never be allergic to it. It's not dangerous. It has so many antimicrobial, antifungal, antiparasitic, antiviral factors to it. So there's a lot of benefits in dentistry that we use it for. How we use it is, on a multitude. I use it for almost every patient for different purposes. It can reduce sensitivity. It can help fight off infections, periodontal disease, get out the biofilm underneath the gingival tissues. You can inject it. People that are having issues with systemic problems and TMJ, scars. There's
never heard
so
of it
many.
used in TMJ before. That's interesting.
Yeah, Dr. Nicole Vane had some ozone help with her TMJ this past weekend. It's just phenomenal what it can do, and the fact that there really isn't any downside to it is unbelievable, in my opinion, why more people aren't using that, because hands down, under a filling or a root canal or, for cleanings, we ozonate water in our office. That's all we use. We ozonate oils that you can use for anything from periodontal disease to really skin infections instead of a Neosporin, acne. There's so many uses for it. And like I said, it's easy and it's non-invasive. It's safe and effective.
Would it be because? Oh, I'm sorry. Go ahead, Heath.
So now going back, I understood you did the ozone to helps kill infections and stuff. I mean, obviously, a lot of people are faced with, as they get older, this difference between like a bridge and a post. Do you guys do post? I mean, is that what you're doing? Is you're saying pull like the bad root canal or the tooth that may be infected? And what do you do with it at that point? You said you use ozone to kill the infection, which is awesome. But are you guys still doing post? Is that really the only method right there?
Yes, so I think, are you referring to post as implants?
So after you have a bad root canal, if you have a bad root canal, you have to have it pulled. You're saying you use ozone. Is still the only option that is then really a post?
It's either a post or implant or a bridge or nothing or something removable. I mean, really, those are your options. Now, the post or implants there's anything from titanium to zirconium. We do muscle testing. Most people I don't do a lot of metals in my practice at all. There's a lot of galvanic issues that go on with that, but that's on a different story. But the implants themselels that are placed as they take place of a root of a tooth be made by different materials. So
I was interested because that's a big business right now.
Huge business.
You see a lot of commercials on TV really pushing you have the same day. So I'm very interested in. I'm sure a lot of other people.
What's wrong with your mouth? We'll just take all your teeth out for you and put in new ones. Yeah, that's really big on TV right now. People getting a whole new set of teeth, and you go, I don't know. I don't know if that's such a good idea.
Yeah, and you have to realize too that implants, long-term studies, you have to look at that too, and you are placing something foreign in your body. So I have actually taken out quite a bit of titanium implants that some patients have had rejection to. So you have to, it takes a while to get them out because the bone's already adhered to them. So it is still putting something foreign in your body. There can be rejection. Sometimes there's not. But the one thing about implants is that it's the only thing that will preserve the bone in that area. If you have a bridge, you get resorption after a period of time. If you do a partial, it's the same thing. So sometimes you're limited, especially if it's in the front of your mouth. So.
Yeah, well, thanks for humoring me and all my questions. But I think it's something that a lot of people deal with, because as we get older, I mean, I think a lot of people are faced with that decision. It's like, what do I do?
Yeah.
You know? And
absolutely.
Well, and he's always looking for free health advice on the show, you know. No.
Oh, yeah, absolutely. We're here for you.
Yeah. It's interesting, though, to see that, I mean, as far as dentistry, I mean, we all hate the dentist, right? That's always.
I'm used to that.
Yeah, and you avoid it, and we spend very little time figuring out our dentistry. It's more of a go in, get it done, get out, instead of thinking it as actually a part of your overall health. And I've noticed just by going to a holistic dentist, which I've been doing for about, I'd say 3 years now, I've noticed the difference. As far as my gum health is far better than it was going to a traditional dentist. And I noticed the difference. Dr. Vane used ozone on me last time, and that was the first time in the cleaning, and I did notice a difference. You know, can you talk about some of the techniques that are used today in or standard dentistry that you should avoid? Because I had the planing done. They talked me into the planing. It's a deep cleaning, right? Well, I find out after, you know, I've been good. I was all, I'm not doing this for like 10 years. And finally they broke me, and I went, fine, I'll get it. Just leave me alone. Yeah. And it totally screwed up my gums. Now all my gums are receding from where the deep cleaning was done, which I never had before. And I found out that's a common problem.
It's a very common problem, and I would say in the periodontal department of most dental practice, it's a big problem because they're regimented. It's kind of cookie cutter for a lot of periodontal patients. You have to understand the kind of biology underneath the gingival tissue. There's a lot of what we call biofilm, which is made up a lot of bacteria and different kind of bugs. So you want to use ozonated water just to flush that out. Because it's so antimicrobial. If you're just going underneath the gum line and just, you know, ripping it out and scaling the heck out of the root surface, you're actually embedding a lot of bacteria inside the root surface. So a lot of it is just not being educated about it or not understanding really the biophysics of that underneath and what you need to do. Now, it doesn't mean we never, ever go down into a deep pocket and scale. Or a lot of times if you have a deep pocket, we'll inject ozone into that area, flush it out. You can inject ozone along all the areas of the mouth and, you know, get on a protocol. So, you know, one of the protocols obviously is nutrition. I mean, sugar loves those things. And so if their diet isn't conforming to, you know, to that and high sugar, high carbs, you know, it's a whole source of information. I think that most of the public they're not educated about it. So the use of ozone has dramatically changed the way we not just do periodontal and cleanings, but obviously the way that we do general dentistry too. But I think it's just an education source for people. That's why it's just more whole body, and I do believe that you can damage the gums, and I hear that all the time. I mean, you're not the first one. So, yeah, well, I just think
it's a significant difference. I mean, it's very noticeable. Now I'm upset because now I have to fix a problem I didn't have before. And right. It makes sense, though, that they were releasing all this bacteria and everything in there, and they didn't properly clean it out, so it was probably embedded in my gum, and then just started killing the gum, and then it just starts receding. As nature would do. Yeah, it makes sense.
And then you're not giving a proper probiotic to, you know, get all that good bacteria back in. So it goes on. And I think the more that
I remember, I fought them forever, and I would say I got in there and I thought, you know, because I'd known a couple other people had it done, and it was done a totally different way. They gave me zero. I got zero. I mean, all they did was crank away and then boot me out the door, and I didn't get any health advice. I didn't get any follow-up. I got nothing. And
except a big bill, right?
Well, yeah, exactly. And I'm all, thanks. You know, you finally talked me into this stupid thing. And that's probably I guess that's the best way to interrelate some of the drawbacks of modern medicine and modern dentistry is they kind of act the same way. It's attack the symptom instead of the cause. And that's what they were doing, you know, instead of looking at, because back then, you know, I think I was no different than anyone. Thought I was eating healthy, but I wasn't, because this was done quite a while ago. But I was still finding my way, and so I'd had all these years of neglect in my mouth, along with my health. And instead of going, hey, you know, Gary, what are you eating? Or maybe there's some way, or talking about probiotics, or none of that happened. So, you know, like I said, they thought that would fix it, and it didn't. Now I had another problem, and now they're here to offer their assistance to fix the next problem that they just created, kind of like the drug industry. We're going to give you one drug, then you got to take 4 other drugs to counteract the drug we just gave you. So
well, I mean, it's the same when you take one tooth, let's just say, and the history of that one tooth. You know, maybe your bite was off, and so they ground down a tooth, and then you had a little bit of decay, and they started drilling in that tooth, and they shouldn't have, because we can use laser to detect whether or not you have a cavity there or not. Drilled out a tooth, put a filling in. It was a mercury filling. Then it broke down. Then you cracked the tooth. Then you had to get a crown. Now a root canal. Then, I mean, it's on and on and on and on. So you look at the history, and that can be avoided. So it's looking, you know, that's why I treat a lot of children too. So I teach them at a very young age. I have a 10 and 12-year-old, and they know, you know, you have to take good care of your teeth and mouth, and nutrition is about it too. And the things that I teach them, they're like, oh, Mom, really? Ozone again? My daughter had a massive ear infection last weekend, and we just hooked her up to a stethoscope with ozone coming out of the stethoscope. And that day, I mean, gone. No pain at all. It's unbelievable. I mean, you can shoot it in your ears, like up the nose if you have a lot of allergies. And it's amazing. And, you know, a lot of it needs to be taught at a young age too, because now here we are, you know, in our 40s, and we were never taught that way. So it really isn't our fault. But I think just these kinds of interviews educate people about what is holistic dentistry. So it's not only about your teeth, it's about your health also. So.
I just actually gave I was a speaker at an event where I talked about the benefits of, and this fits right in because the money you spend, because another person, it was interesting, the tie-in, he was a guy who did investing. So he talked about how you're on the consumer, you're on this consume, and then I get up and talk about health, and it was interesting. I talk about consume, and how it all interrelates, and I think that's unfortunately where the medical industry has gone, is that they have you. I mean, if they keep you sick, it's perpetual. You'll never get off it. I'm not saying you'll never go to a doctor, never go to a dentist again, but you can save tens of thousands of dollars at the bare minimum.
Yes.
Just by being healthy and eating right, and that will far outweigh the price you'll pay for food.
Yes.
And, you know, and proper supplementation if you need it. And that's the hardest thing I think of putting in people's head is you're investing in your future and your health. And it's weird. You can tell them till you're red in the face that they'll feel better, they'll look better. But as soon as you say, hey, by the way, it's going to save you money, and they go, well, hold on, go back. You know, they're all, oh, I can save money too. And that kind of changes their attitude. Have you noticed that do you talk to them in the frame of, hey, you won't have to see me as often, and you can pay less? Do they kind of react to that as well, the financial side?
Oh, sure. And it's all added value. I mean, it's like buying a car. I mean, we don't really need what we have, right? I mean, it's value. You know, we sometimes, because we're a little bit more expensive than a traditional dentist, and it's because of the things that we do. You know, for fillings, we'll add ozone. I do homeopathics. I add a lot of things, you know, that are kind of adjunctive to help that area out. So those are the kinds of things that are value added. And once people, you know, that's all they want. They want to know that they're going to feel better. It's not going to be painful. They have value to what we're doing, and that's what we get. And I think once people understand that, then they're like, oh, wow, I didn't know about that. I didn't know you were doing that to my tooth. So we educate them about actually what we're doing and why. And then they start understanding. Then that's how the referrals keep coming in, and that's how education is. You're always going to need a dentist, but there's quite a few different ways to do it, and it's very passionate for me, and I truly believe in the things that I do. You can't deny the fact that people walk up from your chair, and I do a lot of general anesthesia cases where somebody wants to get everything done like in one visit, and removal of infection or cavitation or root canals or mercury, and they literally get up from like a 5-hour surgery from the chair, and they're like hysterically crying, they're hugging, and they don't know why. They're like getting off of anesthesia, and they're like, I haven't felt this good in 20 years. And I had a patient, her husband came back the week later and said, what did you do to my wife? And I said, I don't know. Just did what I'm supposed to do. And he goes, whatever you did to her, I want you to do to me. Because she was on meds for 25 years. She never slept, just on and on and on. And she just cold turkey went off of them. I removed all this infection, and she's literally a different person. And it's really all because this area of her mouth, just the infection was removed, and her body just responded to that.
I've heard that several times, actually, that fixing a bad root canal is the actual difference you notice is immediate. Like within 24 hours, I've talked to people, they go, oh my God, I cannot believe how much better I feel today.
Yeah, and it can be not for everybody. I will say that everybody's system's a little bit different. Their immune response is a lot different, and that's the question I get is, am I going to feel better? Like, I've had these silver fillings in forever, but, and most people go, it's same with the medical industry is, if it doesn't hurt, I'm not going to fix it. Well, that's not the case. It's affecting you systemically, and 20 years down the road, maybe you have some autoimmune issue, maybe you have some heart issues. Lyme disease is a big thing now. There's so many things that can affect you that I don't think people realize that it's not a pain. You don't just look at pain. There's a lot more that is associated with that.
With the amalgam fillings, maybe go into that, because that's probably the most common thing, especially in the holistic health world, is talking about the damage of amalgam fillings and why you should have them removed if you have them.
Okay, so basically the silver fillings that people have, they're about 50% mercury. People need to realize that 50% mercury, which is with other mixed metals in it as well. But mercury, if you just Google it, it's one of the most highly toxic substances on the planet. So, I wouldn't want that in my mouth. And when you start reading about it, there's a whole political thing about the ADA. They'll never say you can never use it. There's always, hidden agendas and reasons why they say that it's still, quote, safe to put in people's mouths because of the levels of vapor that are generated from it, as they what they consider kind of a safe amount. Well, in my opinion, no amount safe. So that's why I wouldn't ingest fluoride. It's the same toxic substance, but the mercury releases vapor, and the vapor is a neurotoxin. So it does cross your blood-brain barrier, and it does sit in your organ systems, period. That's science. It's not something we made up. So it's very hard once it's in your system to chelate that out. It's a whole process. It's another story. And so depending on your immune response, I had patients walking into my office literally shaking like on one side of their body, and they open their mouth and every single tooth is filled with mercury. So wow. It's just, not everybody responds to that. There are a lot of people walking out there with mercury fillings and their system is okay. It doesn't mean it's going to be okay 5 years from now. So it's the education about it and making an informed decision. Now, just because you walk into my office, I'm not going to say you need all your mercury out, but what usually happens when you start educating people, they come back and say, I want these out now, just like you did, Gary.
Yeah.
It's just, it's not a healthy thing. How can you be taking care of your body in all these amazing ways and still breathing in mercury? Now, mercury, when you brush your teeth, when you eat hot, cold foods, certain acidic foods, it is awful. I mean, that's when the vapor is released. So it's just when you start diving into mercury and what it can really do, it was all kind of a money thing, and it's cheap. Insurance will pay for it.
It boils down to money?
Yeah, yeah, really. So it's pretty unbelievable, and once you understand that, it's it's corrosive. It breaks down. Plaque is attracted to it. It leaches into the root system of your teeth, and sometimes in the gum tissue. I mean, we'll find what we call mercury amalgam tattoos, and it's literally in the tissue. I mean, you can use a laser to try to dig it out, but it's kind of in there. It's hard. I've been practicing for about 16 years, and I used to not be protected when I removed them. So I always wanted to get my mercury tested. So I had hair, stool, blood, urine, like the whole thing. And I was shocked. I thought it would be really, really high. It was borderline. So, nutritionally I'm doing some things and, just to kind of get that out of my system. But it takes a long time. And, obviously when we remove it, we're protected and we have ventilators and, the whole bit, because that's another problem in traditional dentistry and traditional dentist office where they just remove them, they just drill them out, and everyone's sitting there breathing this mercury vapor, and a lot of health issues related to that too, because you can't smell it, you can't see it, you can't taste it, and it's there in the offices. And so it's just the one thing that gets me a little bit irritated and shocked is that people know about this. It's science. They know, and they still. I mean, I had a little boy come to my office a few weeks ago, and his dad had taken him to a pediatric dentist. Came back, and the mom, who was very holistic, he got 4 amalgam fillings, and the dad didn't know, and she flipped out, and so brought the little boy to my office and wanted them all removed. I mean, like 3 days later. And so it's unbelievable that pediatric, they know what this is doing. Like, this is a child. Their immune system isn't fully developed. How do you, it can't be a money issue. Like, you can't do this. Like, it's right, your brain's right here. It's unbelievable.
Well, we've just been brainwashed. I mean, that's the bottom line is, I talk about this a lot, just in health in general. And we do, and I was, this place where I was at this weekend is a lot more free thinkers is the best way to put it. And we talked about that we do a lot of things as humans in America and worldwide that we don't need to do. I mean, you could say, why are you doing that? It doesn't cost you any more. There's no reason not to do it, but we just do it, and it's just because we've been told that that's the way to do it. And it gets frustrating, I'm sure with you too in the health world, because you consult as well, is trying to break down those barriers of making people understand that, why would you do that if you don't have to? Why would you put in amalgam fillings if you don't have to? And it's just, we don't think anymore. It's more of, health is way down at the bottom. They'll go spend far more time researching their new big screen TV than they ever will about anything to do with their health, because they'd rather watch the Kardashians instead of eating fruits and vegetables, which, that's just a thing we have to deal with in general. So that's a topic for another time as well.
That's true. That's true. We could talk hours on that.
About our self-destruction of humans and what we do to ourselves.
Well, it's a lot of it is also about, just going against the grain, doing what you know is right, what you feel in your heart, what you've seen, as a practitioner too. The things that I've seen have been unbelievable. And, I know I'm doing the right thing. I mean, I put somebody's health in my hands, and, everything that I research and that I go to, you can't disregard that. And I think people are a little frightened to, not do what they learned in dental school or, what everyone else is doing. So it's a shame, but, it's hard to change. People don't like change. So
have you seen it catching on more and more, though, far as are people starting to open up more and more to that type of thought process of being more open-minded and understanding that, there's a different perspective as far as health. Because when I look at dentistry now, I look at it completely tied in with everything. I know most people, like we discussed earlier, don't look at it that way. But are you seeing people coming to you as patients that are more and more concerned about their health?
Yes, well, especially in the San Diego area, I will say. I mean, I grew up back east, and it wasn't really like that back there. We're kind of lucky because in San Diego, it's very health-minded, a lot of active people looking for alternative treatments, things like that. So I will say in my area, you do have a lot of people say, oh, I heard about this, or I heard about ozone. I don't really understand what it is, but, let me know what that is. And just it's a lot of it's word of mouth, getting out into the open and just letting people know the things that holistic dentistry can do. And it's not, quackery, or it's not something that we're making up. It's all interrelated. That's why when Dr. Bain introduced us, I mean, the things that you teach or everything that I stand for as well. I mean, I grew up with this. I mean, I kind of live my life like this, and it's all interrelated. So I think the more that people understand that it's not just a tooth, or it's not, it's just medicine can be like naturopaths around the area, different kinds of treatments that we learn from different people. We can use them in dentistry as well. I mean, there's so many uses for things, and I see it a lot, so I feel fortunate about that. But obviously, we don't want to just spread the word on the West Coast. I mean, it's kind of worldwide. In different countries, I think that they're a little bit more open-minded. A lot of places in Europe, my husband and I travel a lot, and I always ask about dentistry and how it is there. And it's different in different countries, but I think they're a little bit more open-minded to health and different kinds of alternative treatments. So I think it's getting out there. It's just like the Paleo movement, or what, it takes time, and not everybody, we think it's amazing. I think it's amazing. It takes time for people to kind of adopt those principles, and so just getting out there and doing what we're doing.
Yeah, I was so fortunate. Growing up, my mom always practiced no amalgam. Always had everything porcelain in my mouth. It was always like,
that's awesome.
And she knew, like, from such, for so long, and I was so lucky,
Yeah.
And, just going back to, I really recommend anybody watching this to get the infection out of their mouths, because I struggled with really low energy many years ago, and not until I got the infection out of my mouth did I really I just saw a noticeable difference in terms of weight loss and my energy level, because your body's constantly trying to fight that infection, and it's causing all sorts of other health issues. So I definitely recommend anybody, go see a holistic practitioner if you're in San Diego. Can you give out your web address and, kind of let everybody know how to find you? And
yeah, absolutely.
If we want to support you, we'll put some links on the bottom of the video.
Your practice address too, where you're located at, how to get a hold of you, all that.
Sure, yeah. So I practice at Moonlight Beach Dental, and it's on 345 South Coast Highway 101 in Encinitas, California, 92024. So I have a website, drstacygodes.com, STACYGODES.com, and there's a lot of information on there too. We're trying to do a lot more videos and just to kind of get the word out. But I also have a Facebook page under Dr. Stacy Godes Holistic Dentist. And it's funny. I was just, before we went on the interview, I was just looking up holistic dentist, like San Diego, and what is holistic dentist, or how does dentistry holistic tie into nutrition, and my name's up there too. So just check me out too. And awesome. We do consults at our office as well, and just if you have any kind of questions, because the more that people know about it, the better, and we're here to help. So,
well, I'm going to be calling you here.
Awesome.
Another recommended customer. This is a funny story to end with. A girl I grew up with actually contacted me because she had some dental issues, and she actually ended up seeing Dr. Bain. She lives probably 300-400 miles away, and traveled all the way because she ends up in Southern California. and she was very thankful. So, I mean, people will travel a long way for a
They
good...
will.
Yeah.
They will. We have people from, gosh, all over. So, yeah, I mean, maybe one day there'll be holistic dentists in every city. Who knows? But right now, yeah, we're worth it. I will tell you that.
Absolutely.
Awesome. Well, thanks so much for coming on. We're going to put this all over the place and get the word out. And if anybody has any questions for us, make sure to email Gary at gary@theprimalshow.com, myself, Heath at theprimalshow.com. Make sure to hit the subscribe button so you can stay up to date with all of our videos, and we'll talk to you soon. Thanks so much.
Hey, thank you so much. Appreciate it.